Good morning. This is Debi Mathias, Director of the QRIS National Learning Network from the BUILD Initiative, and I'll be serving as your moderator today. The Early Learning Challenge Collaborative, a partnership between BUILD and the First 5 Years Fund, would like to welcome participants and presenting states to this webinar on QRIS online application and tracking system. Before we get much further along, I'd like to just poll and make sure that we have folks, although I can see some names and I know what states you're from, but I believe we have folks from Illinois. Can we hear who's from Illinois on the call?
Joellen Whitehead from INCRA and Dawn Whitehead from INCRA are here as well.
Anyone else from
Governor's Office?
Oh, great.
Rhonda Clark, Illinois State Board of Ed.
Terrific. And I can see we have some folks from Oregon. Could you please introduce yourselves?
Debbie Trammell and Mark Wardell from Child Care Division.
Ronnie Pham from the Child Care Division.
And Dawn Woods from the Child Care Division. Hi, Debbie.
Hi. Welcome aboard. And I can see that we have some folks from Pennsylvania. Could you please introduce yourselves?
Hi, Debbie. It's Katrina Coburn and Jen Bender from the Pennsylvania Key.
Great. Anyone else from Pennsylvania? Okay, how about Colorado?
Sorry.
Hello?
Hi, it's Catherine from Pennsylvania, also, Office
Hey.
of Child and Early Learning.
Hi, Catherine. Great. Welcome aboard.
Hi, Jennifer Stedron here from Colorado.
Oh, great. Anyone else from Colorado?
A few others might join later.
Okay, that's terrific. Well, I'd like to thank all the states that are joining in and participating in the webinar, and I'd also like to thank our speakers for today. Let me see, move ahead. Okay, and we have Karen Rohrbach, the Senior Director of Early Learning Innovation, Early Childhood Investment Corporation from Michigan, and she's going to lead us off today. This is the order of our presenters today, and we're starting at the newest system in Michigan and moving to Maine, which has the most mature system for online application and tracking. So Karen's going to kick us off, and then we'll go to Arizona with Ginger Sandweg, Quality First Coordinator, First Things First from Arizona. And wrapping us up will be Alan Cobo-Lewis, Associate Professor of Psychology from the University of Maine. I'm just so excited to hear all this content myself. Pardon me if I get lost in listening too much, but I'm really looking forward to hearing, and again, thank the presenters for everything they've pulled together. I'd like to just remind folks that to mute, you can push *6, and to unmute, you can push *7. And I often realize after I've been talking for a minute or two that I've actually had my phone on mute. So just be careful about following through with the mute *6 and unmute *7. Well, without further ado, Karen, let's have you get started.
So can everybody hear me?
Yes, we can hear you.
Okay, great. Thank you. So our system in Michigan is called Great Start to Quality, and you can see from the graphic that everybody is in our system. The Great Start to Quality is led by the Michigan Department of Education Office of Great Start, and it's implemented by the Early Childhood Investment Corporation. So that's who I work for, the Early Childhood Investment Corporation, and we're responsible for implementing Great Start to Quality, our rating system in Michigan. As you can see from the graphic, as I said, everybody is included. The ratings and the star levels are only for our licensed programs, and in Michigan, everybody is licensed with the exception of early childhood special education. So it includes our Head Start programs, our state-funded pre-kindergarten programs, all of our center-based programs, and all of our family home-based programs. The only ones who are not licensed by the state of Michigan are unlicensed, or what most states call their family friend and neighbor providers. They are still able to participate in Great Start to Quality. As you can see from the graphic, we just don't rate them. So there's a mandatory training that every unlicensed provider must take in order to become an unlicensed provider. And then they can continue to take training, which is denoted by the additional tiers, Tier 2 and Tier 3. Everybody in Great Start to Quality, by nature of being licensed, begins at our 1-star level. Great Start to Quality Stars is the name of our platform. We also have greatstartconnect.org. The Great Start to Quality Stars platform, which I'll review with you, is connected to our other database called greatstartconnect.org, and it's Michigan's resource and referral online database. Great Start Connect is connected to our licensing database with a daily data share. So everything that is in licensing is shared with greatstartconnect.org. And what that means is that every family that's doing a search on Great Start Connect has real-time, up-to-date information. Programs can go into Great Start Connect and update a profile that displays publicly. This profile is then also shared with our Great Start to Quality Stars platform. Again, so that the information is consistent and is as accurate as possible. That is also a daily data share. And then the information that is affiliated with the rating that's in the STARS platform comes back to Great Start Connect, again, daily. So everything is, there's 3 systems that are sharing data information right now. The STARS platform, Great Start Connect, and then shared with the licensing database. So you can see the arrow at the top. Programs enter Great Start to Quality through their Great Start Connect profile. And that's right up at the top of the page. It navigates them to our Great Start to Quality Stars platform. You can see on the left that there's a navigation tab. There's a welcome and introduction. The welcome and introduction page has resources, online tutorials, and a whole set of frequently asked questions related to our system. And then this is where the program begins their participation in our rating system. They can look at their program profile and make any updates that they need to make. And then they would go to the self-assessment survey, which is the screenshot that you see here. The self-assessment survey is an online version of our program quality standards. And there are 5 categories: qualifications and experience, family and community partnership, environment, curriculum, and I'm forgetting one, forgive me. And then the indicators you can see under early childhood educator qualifications and professional development. Then there's individual indicators that the program would self-assess again. So the first one here is administrator qualifications. They would click on that, and then they would answer questions and check the appropriate boxes, and it in turn gives them a score. At the end of each section, you can see at the bottom where it says subtotal and then meets the criteria for this rating. It will tell them where they're falling in our 1 to 5 star level as they're completing the self-assessment, how they're doing in relation to the overall rating. The Great Start to Quality Stars platform has an administrative side, and the administrative side is where we're following and tracking all of our technical assistance. So the tabs that you see on the left are all the tabs that I can see as a super administrator. Depending on the administrative level, different administrators have different levels of access. The calendar that you see here, which is a really nice feature, is a calendar that would be used by somebody who's monitoring the quality improvement consultant. And those are the ones that do all of the quality improvement support for a program once they've completed their self-assessment, or receive a program quality assessment, which is what Michigan is using instead of an environmental rating scale for our highest programs. There are different colors on the calendar, and the different colors denote different supports that the quality improvement consultant is providing. So one color is for a quality improvement visit after a self-assessment validation. Another color is for a results visit after a program quality assessment. And then another color is, or a different color could be the actual consultation. It's hard to see, but each program is tracked here. So if I'm a quality improvement consultant, I would log on this calendar which program I'm meeting with by the license ID number, and then that way we can track per program the individual technical assistance that's being provided. There's a whole set of reports, so I wanted you just to see that, that the platform has reporting as well. You can see from this reports page that there's a variety of different reports that are available. We can see everything from what I was just showing you on the calendar. I can run a report on the calendar by individual consultant and see which programs they are visiting with. I can run it by program to see what supports have been provided to that individual program. The report that's run most often, of course, is the programs and the variety of levels that they're at. And we can disaggregate that by region. We have 10 regions in Michigan. And this is just to show you what displays to families. So as our ratings are not public yet, the first set of ratings will become public in December of this year. And they'll be posted here on this page. So we're back to Great Start Connect. The information is shared back to Great Start Connect, and it'll be displayed here on this page. This is what displays to parents when they do their search. So there's a little bit about the program. If a parent were to click on the blue portion, then it takes them to a program profile for that program. You can see the state of Michigan where it says report. That is a licensing report, and it takes you right to the licensing report where they have the most recent inspections. Programs are able to post pictures. And then on the left you can see all the different things that are available for families to choose. So that just a simple checkbox, and they can continue to filter their searches. I wanted to talk a little bit about, I know there was questions about the cost. So I did want to share that building this Great Start to Quality Stars platform was expensive. It is what we can afford in Michigan. We don't have the funds to have individual people going out and supporting the number of programs that we have that need a self-assessment validation or a program quality assessment. There are about 11,000, and it varies between 400 and 500, so 11,400 programs that are licensed in the state of Michigan, and they can all enter this system and complete a self-assessment. So moving to an online system was a lot more cost-effective and efficient for us, even though it was costly to design. I'll just say that it was over $500,000, and which is comparable to other systems that we looked at. This system is provided by Mosaic out of California, and I believe this was the first system that they built related to supporting a quality rating and improvement platform. Some of the lessons that we learned were that we had the opportunity through the Race to the Top grant application to go ahead and launch our quality rating improvement system, not only online but also statewide. And we took that opportunity. It has resulted in about 3,000 programs that are currently participating in the first year, which we're really excited about. It's about 20–25% of all the licensed programs in Michigan are participating. If we had had more time, I think that's the biggest lesson learned. More time really would have allowed us to build a system that is more supportive of the current program. So that ends it for me. I know, Deb, if you wanted to, if there's any clarifying questions.
Yes, does anyone have any clarifying questions? I have one to kick us off here. So is creating a profile like applying to be in your STARS program? Or is there another paper process at all?
Yeah, so that's a really great question. Everybody who's licensed in Michigan is actually a part of Great Start to Quality. We don't have a step for an application process at this time. So once a program goes in and starts their self-assessment, when they submit their self-assessment, so if I can get back there real quick. Once they hit the button, submit for review, then it automatically puts them in the queue, and then they may be chosen for a random validation to ensure that their self-assessment is correct and accurate. But that really is the self-assessment, and hitting that button is really their entry into continuing further beyond a level 1.
What percent are you validating on the self-report? Have you established something yet, or what are you thinking?
Yeah, right now we're still doing 100%. We wanted to make sure that we established a good data set so we could look at face validity. We're in the process of moving to random validation, which we'll be doing about 25% of programs.
Great. Other states? What about any other questions here or clarifying thoughts?
This is Teresa Holly. Is this linked with, so people have to put in whether they have certain qualifications for their staff. Is it linked to a provider database that says, Jane Smith does in fact have these credentials?
It does not yet. Michigan's in the process of building a professional development registry. We're currently able to track if they take training through Great Start Connect. So if you register for training through Great Start Connect, it is tracked by individual provider. Right now, they have to upload that information into the STARS platform. So they would scan and upload their certificate.
Okay.
Other clarifying questions or ideas?
Hi, this is Dawn from Oregon. And I was just wondering, what was the the time frame, and maybe you mentioned this earlier, so I apologize, of getting this up and running through Mosaic? I mean, to use kind of a canned platform that you obviously customized, how long did it take?
So this was actually the first platform of this magnitude that they built, a full online system. We're always in the process of refining and retooling. We had a full platform that was ready to go in 3 months.
Holy cow.
Wow.
Yes. Yeah.
Karen, when you said that you wished it had more of a feature to support programs, are you talking about like an embedded CQI plan in the database here? Is that what you were meaning? Or a stronger link to TA, or what were you thinking there?
So the next feature that I think we want to have is a link to the certifications. So if there was a professional development registry, we would have that another data share so that there'd be an automatic check. So if I said that my staff had certain credentials, there'd be a way to check that automatically as part of the validation process for the self-assessment. it would be like an automatic validation if we had that data share. There is a feature that I didn't share, which is the quality improvement plan. The quality improvement plan is built right from the self-assessment and how a program's results were on the self-assessment. So it's driven by, you only scored 4 out of 6 points in this indicator. Is this something you want to continue to improve your quality in? And if a program checks that, then they start to build a quality improvement plan based on that. And that's all still right in the system.
Is there an opportunity in the CQI plan for the program to add things that aren't specifically standards relevant, but directions they're wanting? So they can also add in, right, and really work that plan?
Yes, they can.
That's excellent. Okay, cool. Other questions for Karen?
This is Joellen from Illinois, and I was just wondering, I saw your calendar where your technical assistance folks log their visits. Do they also track data regarding more information about their visit? What kind of assistance was provided? Do they try and tie it to the quality improvement plan at all, or your standards?
Yes. So there's also a place for them to put in their summaries of their visits, and they can actually go, if a program has a quality improvement plan, the consultant can go right into the plan, review it, and add comments. So they're not always having to do on-site consultation. There is some online support as well.
Well, Karen, that was just so informative. Thank you so much for starting us off, and we may come back to questions. If you think of something during next presentations pertaining to Karen's presentation at the end of all 3 presentations, hopefully we'll have a little bit of time to go back, so just make a note for yourself. And now what we'd like to do is ask Ginger Sandwich to begin on Quality First, Arizona's QRIS.
Hello, everyone. Hi. I'm Ginger Sandwig. I'm the Director of the Quality Improvement and Rating System here in Arizona. And our system is a voluntary system, and it's based on the amount of funding that's available. So at this point, we have about 25% of our licensed and certified programs across the state participating in Quality First. The funding that's available is through regional councils. So we have 31 regional councils across the state that have a certain allocation of funding, and they determine how many slots their funding is going to support in their region. So while we would like to be able to offer this program to anybody and everybody across the state of Arizona, at this point we don't have the funding to do that. So let me show you our application system. We, first things first, is the state agency that manages and is the administrative home for the Quality Improvement and Rating System. And on our organization homepage, there is a button for Quality First participants. So this is where they would go to click to apply. They would click on this button, and it takes them to the instructions, to a program consent, and to an application. And I won't go into those in depth, but I've put them on here for you so that if anybody wants to download and look what we have written for the application instructions and application and consent, you're welcome to do that. But basically, the application instructions tell you what to expect for the application. There's a button here on the bottom that you can click that you've read the instructions to then continue. When you click the continue button, you move into the program consent. All programs will acknowledge this consent form that basically says they are agreeing to have a star rating calculated for them through a program assessment. So we, and you can see the assessment visit is detailed. We assess every single program in our Quality Improvement and Rating System. Currently across the state we have about 800 programs enrolled, and by the end of this fiscal year, so by June this year, we anticipate about a little over 1,000 programs in. So all of those programs are getting a program assessment using the environment rating scale as well as the classroom assessment scoring system. Currently just the pre-K version. We'll be implementing the toddler version soon. So once they acknowledge the program consent and click the Continue button, it then goes into the application. And again, I won't go into everything on the application, but I've put in 3 different slides. You can see all of the questions that we ask on the application. All right. So once they submit their application, that application goes into basically a warehouse. And the applications are categorized in our system. So we have archived applications. We have programs resubmit an application each year, mainly because programs will close, new programs will open, program information might change, such as a new director that comes on, or they changed their license, and instead of being a DES certified family child care home, they're now a DHS licensed family child care home. So because all of this information that we're asking on the application changes frequently, we archive applications every year and then have programs reapply through that same application process. Once we receive their application, the application goes into eligibility check, and I'll show you what eligibility check looks like in a couple of slides. But basically, we verify the information on that application. It then goes into eligible pending review, that yes, we verified the information on the application and it's ready to go into our scoring system. So you can see they're ready for scoring is not the next one down, but the one after that. Possible duplicate, we have programs that will apply multiple times within the same year, and our system will flag those as this might be a duplicate application, so that we can go back into applications and make sure that there are no duplicates. Once a program is in ready for scoring, we will run a campaign to select programs to participate, and then they will go into our selection process. So I'll show you about that in a minute. The selected for rating only, we have 2 types of participation here in Arizona. One is full participation with all of the supports and benefits. So they get a coach, they get financial incentives, they have teach scholarships for their staff to go back to school. They have child care health consultations. So there's a full participation option. There's also a rating-only option in which a program comes in and all they get is an assessment, and they get 6 months of coaching to help them prepare for that assessment process. And then selected pending verification is when an application goes into when they've actually been selected for the full participation package. And then unregulated are those programs that are not regulated. In order to be involved in Quality First, you must be regulated either by Department of Economic Security, and that's for child care family homes serving 4 children or less, or you can be regulated by the Department of Health Services Bureau of Child Care Licensure, which is for family homes serving 5 or more children, as well as child care facilities, or tribal program regulation or military regulation. And then there's a little button that we can view all of them, so we can sort. So if we click on View All, you can see the Quality First applications, the search features in our warehouse. So we can go into viewing all of the applications in all of these different subsets, and we can sort by application date. We can sort by the organization name that a program put on their application. We can sort by their site name, the type of program that they are. Are they a home or a center? We can sort by their address or look up by their address. We can see which region a program is in. So if we know that, for instance, Central Phoenix has 10 slots that we need to fill, we can sort and see, are there 10 programs in Central Phoenix that have applied that we can actually select? All right. So you can see once we can enter in something to sort by, all of the program information comes up. And you'll see there are two blue colored words. There's an edit and there's a no match. When we are verifying applications, we click on the no match link. Some of them will say perfect match, some of them will say possible match, and basically what that system is doing is it links with our child care licensure for verifying their license information. Sometimes there will be no match because the address that the provider typed in on their application uses N period for north, and the licensing application or the licensing system has north spelled out. So what we do is we go in and we look to see, is this the program that licensing has, and then we can see if they're in good standing. The other feature, the edit feature, actually allows us to go directly into their application and make any changes that we see fit as we look at the child care licensing system. So we can change it to match exactly the address, the license number, everything, so that we do have a match, and then we can move it into our eligible pending review. So this is when we go into eligibility check, when we go into that no match field, this is what we get. You can see that the first column just has all of the organization name, site name, street address, etc. The second column has what's entered in the online application that they filled out for Quality First. And then the third column has our licensing data. So this is what it says in the licensing system. Since this is our test site, you can see that there's no information available because it is a test site. There is a confirmation method. So if we in fact have to call the provider to say, can you give us the DHS license number again? There might have been a typo in the application. We're not seeing this in the system. We can click down this button. This one says phone, there's email, there's fax, so that we can confirm with the provider. And then the eligibility notes, we log in who made the phone call, who verified the application, so that we can then move them into our selection warehouse. This bottom part, status, is a drop-down menu. So if we make any changes in the application, we can reprocess for eligibility. So for instance, say the provider mistyped their license number in, we can go in and make the change, and then we reprocess for eligibility, and then that match piece will come up saying perfect match. We can move this application into unregulated status. We can move this application into regulated but not in good standing with their regulatory agency status. And then we can also move this application into the eligible pending review, which is the precursor to being selected for participation. All right. So when we have programs ready to be selected, we run a campaign. We don't hand-pick programs and say, you get in and you don't. Our system actually generates the list of priorities. In the beginning of Quality First, about 3 years ago, because we don't have enough funds to get every program in that we would like to get in, we prioritized by certain features of a child care program. So some regions would prioritize by, they have a 12-month program, or they serve infants and toddlers, or they have a high percentage of DES children or child care subsidized children. So the system would take all of that information, screen the applications for that, score them, and then put them in a priority order. So you can see we enter all of this information into a campaign. We tell the region, so each of the applications based on their zip code is assigned to a region, and so we put in that region so that the computer knows to select only programs in this particular region. We then put in the program type, so if it's a full participation slot with all of the supports and benefits, or if it's a rating only slot. We put in how many slots. We might be selecting only 2 slots. We might be selecting 17 slots. We can put in that number. Again, we put in the location. We put in the type because some regions will tell us we want a certain number of center-based programs or we want a certain number of home-based programs, so we have the system identify which program gets a slot. And then we put in the last submit date. So we can say we're only selecting from applicants who have applied before X date. So once we run that campaign, oh, here's some more. We also put the award date. So once we award slots, it will automatically tell us which date the slot was awarded. And then we have funding type because at one point the state was funding a certain number of slots and each of our 31 regions were funding a certain number of slots. So we have an ability to tell the system where to bill for this slot. And then we have any notes. So you can see this note is this was a campaign to fill 9 expansion centers for fiscal year 12 and 1 vacancy that declined in fiscal year 11. So we have an ability to say why we did this campaign. So once programs are selected, we will then assign those programs for service. You can see on the left-hand side there's coaching assignments, assessor assignments, mental health consultation assignments, inclusion coach assignments, and child care health consultation assignments. We started out our system with only being able to assign to coaches and assessors. And as we have added more programs and services across the state, we felt the need to add those consultants in. So all of those consultants are able to enter into a program's profile and make notes and get program information, etc. So we can assign centers to a coach or an assessor or all of these. And you can see next to it there's, I showed you the screen that we go into, that these are our grantees that provide the services. So we would select the particular grantee and then assign that program within that grantee's area. So you can see Valley of the Sun United Way of Tucson and Southern Arizona. We can select those and then that's where we would assign those programs to. This is the screen when we select a particular grantee. This is the screen that we get, and you can see over here on the far left it says Assign Center, and we just click that box and hit the Save button, and then that center will show up on that particular grantee's screen. When they open it up and look, they'll see that they have a newly assigned center. And it gives all of the center information based on what they indicated on their application. All right. So once a program is selected to participate, all of the information from their application is pulled into what you see here, their profile summary. So all of the information for a center or a home is here. You can see on the left side of the screen there's a bunch of different tabs. So each tab has different information about that site. So you can, what we're on is the profile summary. The next one down is the site tab, which has their licensing information, any accreditation information. There's program information that has some information about the main contact and those kinds of things. There's staffing information. The staffing information is actually verified by our assessment grantee. They do all of the verification of the official transcripts. We are hoping at some point that we'll have a statewide registry and our assessment grantee will no longer have to do that. But at this point, it's hand verified for all the programs. We have a classroom family group tab that shows each classroom in a program, how many children are enrolled, of what age, how many children on IEPs or IFSPs. So it gives all of that information. And then there's some other information about the orientation. Did they get an orientation to quality first? When was that? Did they sign the enrollment agreement? The assessment summary is a tab that any program or any consultant assigned to the program can click in and view all of the assessment reports for the environment rating scales or the classroom assessment scoring system. The Quality First Point Scale tab is we do an additional assessment with regard to their staff qualifications, their ratios and group sizes, their curriculum and child assessment. That has all of the points that they have earned as well as notes about why they earned what points. And then the next three are buttons that we use to determine a rating for a program. You'll see activity log is an area where any consultant that's assigned to that program can go in and log that they've met with the program or they had a phone conversation with the program and a little bit of the gist of what the conversation was about or the site visit was about. There's a tab for quality improvement plans. So each program creates a quality improvement plan and that is uploaded into our system, and then they can make notes on it, or the coach can make notes on it, or the mental health consultant can make notes on it as they move through their goals. There is a calendar of events. So if a program is receiving all of the supports, the mental health consultant can put the dates that they're supposed to be coming by their program. The coach can put in the dates that they're supposed to be coming by. They can add in dates for special trainings. The provider can actually add in dates about when the program is closed so that the consultants know that information. And then there's a tab for their application, so we can print their original application or view their original application. And then these last two buttons are really used here at First Things First, the administrative home. And this is where we actually calculate the rating and verify the calculation before we actually post it publicly. And then the center administration is for us. We can decline a program that is closing or no longer wants to participate. We officially enroll programs through that button. All right. And again, as I talked to, so other users include the coach, the mental health consultant, the child care health consultant, and an inclusion coach. And that's a quick view of our online system. Are there any questions?
I have a question. This is Deb for both you and Karen. I know that Mosaic has a big thinking about using the data for research. How long does it take programs to move? What percent of subsidized children? You know, whatever the benchmarks, and then how are we getting in terms of what we would anticipate the scheme of programs would be? How many of the, what are we headed toward? How many of the Star 3? How many of the Star 4? You know, it's just not a rocket to all programs being Star 5. It's you know, what does the you know, graph look like that we're headed toward or aiming for here? In your system, how are you able, and then Karen, if you have anything to add about this, because I know that Mosaic is really thoughtful about this, how are you positioning your data to be able to use it for research or validation or those types of things?
Right. That's an excellent question. So there's a whole back end of this system. So all of the assessment score information can be pulled into reports. And so we have an evaluation team that actually manipulates that data and analyzes that data to show progression of programs, to show the data around how long does it take for a program to move from a 1-star to a 2-star, from a 2-star to a 3-star, how many programs are in 1-star versus 2-star versus 3-star. We are actually this year starting the process to validate our rating system. So all of the data that is in our application and online provider system can be pulled from the back end to do all of that data analysis. We can tell how many kids of each age group are enrolled across the state, by region, by zip code. We can manipulate and get a lot of data.
That's really great. Now, did you build this internally, or did you have a contractor?
Yes, and I have to say, this is not where we started. This has been an ongoing progression from when we started in 2009. So this was built internally, and on some level, it's a wonderful asset to have it have been built internally, because we can be nimble and redo it or add something in or take something out on a regular basis. And so I meet with our IT team every other week to go through what else can we add, or is it possible to do this in our system. So it makes it a little more nimble because we have done this in-house. But it's evolved over time, and it's continuing to evolve.
And I have one final question, and then I want to go to Karen about the research part. Do the programs pick the services that they want? Like, you have a full menu of services they're eligible for. Do they select the supports that they want, or do they get the whole package?
So it depends. When regions fund Quality First, they fund the coaching, the assessment, the TEACH, early childhood scholarships, the child care scholarships, because with Quality First comes child care scholarships. They fund the financial incentives, and they fund child care health consultation. So all of that comes with the full participation package. Now a program can say, I don't really need child care health consultation right now, so I'm not going to access it right now. But they can access it at any time. They can say, I don't have enough children at 200% of poverty level or below to take all of the scholarships that I'm able to access based on my STAR level. So they can choose not to take it. With regard to the mental health consultation and the inclusion consultation, those are currently at this point, they are not statewide funded strategies. So when I said in the beginning that each region funds specific strategies and funds the number of slots for Quality First, there are some regions that fund on-site mental health consultation. And if a program happens to be in that region, then they can call and access that mental health consultation or the inclusion consultation. Currently, for the entire state, we do have a phone consultation that anyone can access at any time.
Great. Karen, anything about this research question or data for research?
Great. The only thing that I would add, Debbie, is that because we're new, we haven't initiated any kind of validation study on our system. The Office of Great Start, which leads Great Start to Quality, is working because they're part of the Department of Education. They're working with a regional education entity, and they have incorporated Great Start to Quality validation study into the research that they're doing for the state of Michigan. We won't have any results probably for a year, but they already do have, the researchers already do have access to our platform and can look at the data now.
Did they give you any, like, we want you to collect this, or did they have input into how you structured it at all?
We've had conversations with them right now because we're collecting everything. I think we've got everything that they need. As we continue with the validation study, there may be something else they would like us to collect. But right now, like I said, they have access to all the data that we're currently collecting and haven't asked us for anything additionally.
Great. Well, let's go back to, are there any questions for Ginger from the other state participants, clarifying or questions about how their system's working?
Yeah, this is Joellen in Illinois. I was just wondering if programs can access the technical assistance support through the mental health consultant or one of your other consultants if they are not participating in your quality program?
Right. So yes. So for the regions that actually fund on-site mental health consultation or on-site inclusion consultation, some regions will also fund child care health consultation outside of Quality First. So some regions have recognized that not all of their programs are going to be able to get in Quality First. As long as they're on our wait list, as long as they have applied to Quality First, they are able to access those other programs while they're waiting for a slot to open up. Additionally, we have a statewide phone line. Anyone can call that phone line and get over-the-phone assistance with mental health consultation, child care health consultation, or inclusion consultation. So at minimum, everybody has access to a phone line. For the on-site, it depends on the region that they're in and what strategies each region has funded.
Okay, and so I was wondering, do those consultants then document and track their activity in the same system so that if the program later applies for your Quality First, that you can see whether any of that initial consultation may have played a part?
Right.
Or are they not tracking in that system?
They are. So we do not create a profile in our system until the program actually has been selected. However, we have collaboration teams across the state. So when a coach is assigned a program, they will be able to access who else might be working with that program and be able to contact them to have a collaborative meeting about what's the best, what are the strengths of the program, what are some of the things that you've been working on, and they get together to really try to support the program in the best way without overwhelming and having 5, 7 consultants coming in telling them to do completely different things. But for a program that's not in Quality First but is accessing mental health consultation, we wouldn't have that previous information.
Okay, thanks. And I don't want to hog the call, but I did have one more question about showing the programs, the rating scores, and making those available to the consultants. Did you ever get any pushback initially about programs wanting to keep that information kind of hidden, or was that an expectation that you set out in the agreement that they signed that if you are assigned a consultant, they will have access to your rating information?
Yeah, we didn't get any pushback about the other consultants having access to the assessment scores. And yeah, the only pushback that we are getting right now, because we don't have a public website, and we are getting a lot of pushback about moving forward with our public website and actually posting ratings publicly. But with regard to the consultants, the programs have actually freely shared their assessment scores with their other consultants because they want the consultants to know everything, to know the best way to assist them. So we really haven't had any pushback with the other consultants being able to access the assessment scores. And the program actually has access to all of this information except for the activity log. The activity log where consultants will go in and add in notes about their visits and whatnot, that's the only section that the provider doesn't have access to. So the provider can go in and look at their own assessment scores and print them off and give them out to whomever they want to give them to. But we haven't had any pushback with other consultants having access to the assessment scores.
And we have a question from Linda about financial incentives. Did I understand you correctly to say that programs that are selected for full participation, there are financial incentives, but
yes.
if you do the rating only, there are not, right?
Correct. Correct.
Okay. All right. Any other final questions before we move on to Alan and Maine's presentation?
Hi, this is Jennifer, and I'm sorry I may have missed it because I had to take another call, but I understand the Arizona system was built in-house. Did you give an approximate cost and amount of time that took?
I didn't give an approximate cost. I am not quite sure. I could probably, our our IT director is out on maternity leave right now, and I could probably get an approximate cost. For the first 2 years, I know we contracted for some IT people to come in-house and work on it in conjunction with our IT folks. So for the first 2 years, there were some additional costs to building the system, but for the past like year and a half, we haven't had those external contractors in here, and it's just been our in-house modifying and adding in things as we move along.
But it sounds like it did take some time to build.
Yes.
Okay.
Yes, it did. It did.
Thank you.
Mm-hmm.
Well, thank you so much, Ginger, for sharing what Arizona has been doing working on this system, and it was very interesting. And again, if people have questions as they hear Alan's presentation, we can come back to all three of our presenters. But Alan, at this time, I would ask that you would go ahead with your presentation about Maine and what you've been doing along these lines.
That sounds great. Can everybody hear me?
Yep.
Okay. So, Maine's online tiered quality rating an improvement system. You can see that we have, this is a collaboration among the team here at University of Maine, and we did this as part of a cooperative agreement between the University of Maine, the University of Southern Maine, and the state. And the cooperative agreement was because the state was interested in developing systems and had some interest in research, and we at the universities were interested in the research. So we actually kind of built it with the idea that the state would get some of their needs met in terms of providing quality service, and we would get some data that we would use to answer some research questions and publish some of the data. So that was really built in from the start. I don't have any slides about our validation study because I didn't expect that to come up today. But if you'll see the third bullet, Michael Lottie at University of Southern Maine coordinated a validation study that was funded through a data capacity grant from ACF. So let me just get that out of the way first because I don't have slides to prompt me on it. But basically, we have environmental rating scales on about 475 or so of our programs. Some of those are the ERSs were conducted for various purposes, but something a little bit higher than 100 of them was part of Michael's validation study, where we randomly selected programs at our 4 levels of quality for purposes of validating the quality rating system that I'll be talking about today. So that's why it was supported by the state, obviously by the Child Care Block Grant, and the third bullet funded the validation studies. So the structure of the system, in Maine we have 4 steps, and we have separate standards, or standards separately articulated for family and child care programs, for center-based programs, Head Start programs, and school-age programs. You can see the URL where the standards are laid out. That's basically the paper and pencil application manual that programs can actually still use to apply to QRIS, although most of them use the online system. And in fact, if they do use the paper and pencil system, then a colleague of mine at USM inputs their data into the online system. So to our knowledge, Maine was the first state to actually put the application system online. Our system, we give step 1 through step 4 in each of 8 areas, which you can see on the screen: compliance, learning environment, program evaluation, staffing and PD, administrative policies and procedures, parent-family involvement, family resources, and authentic assessment. In each of those areas, programs are rated from 1 to 4, and a program's overall step is the lowest of the 8 areas. And we crosswalked all of the tiered quality rating improvement system standards with the standards for achieving each of the common accreditations, NACI, NASTI, etc. And we exploit administrative data to calculate the answers to many of the questions that we would ask in the paper and pencil system. So, I mean, for example, some of the quality rating assessments involving X% of your personnel with direct involvement with children being at above such and such level in the professional development registry. And we have linkages to the professional development registry at University of Southern Maine such that we can calculate that and not have to ask the provider. And depending on your certification or accreditation rather, we can calculate some of the answers to some of the questions which are required both by QRIS and by the accreditation. So without the pre-calculation of answers, it's roughly 50 questions to complete a QRS application. Depending on the kind of accreditation and type of provider that you are, we can get that down to 10 or sometimes as few as 5 self-report questions. So we do it with the calculations and the administrative links. So in the center, quality rating system is the system that we run here at University of Maine, indexed by program license number. And we link in with the state DHHS program through the program license number, their licensing, so we can verify the licensing status. That data is shipped monthly. We also link in with the child care system so we can see how many children receiving subsidy are in each program. That's not actually required for the quality rating system per se, but it's required for some of the research questions that we ask. We want to know what the distribution across quality levels is, whether it's different for children on subsidy versus children not on subsidy, whether it's different for children receiving family versus center-based care, et cetera. We also link on the right side of the screen to the Professional Development Registry at University of Southern Maine. That has information about the personnel at each child care provider and their what career tracks they're on in the registry and what their status is in terms of training. We also have links to the Professional Development Registry on the accreditation status of the child care providers. We don't have to ask that by self-report. And one thing that I realized when the question came up about incentives, I realized that what's missing from this slide is actually a key linkage that we have to Maine revenue system, because there's two kinds of incentives. The incentive to the provider is that Maine has a tiered subsidy system where the higher your step, the higher your per child rate is on your subsidy dollars per provider. And the other incentive is to the parent. Maine has a child care tax credit, and the amount of the child care tax credit on your state income taxes doubles for if your child is placed at a high quality provider, which means if you're at step 4 on Maine's Quality for Me system. And so we annually feed that information to Maine Revenue Services. So I think I'm not actually going to try to do the online demo. I think I'll just rely on the screenshots when I look at how much time we have. I expect there to be questions as well. Here's, once you get past the login screen for a provider to log into the quality rating system, we initially show them some information about what we think their accreditation status is based on the data that the Professional Development Registry has, and they can verify yes or no, and if it's wrong, then they have to contact the Development Registry to remedy that. In addition, we show the provider what we think their personnel are, what career path the personnel are on, and what level in the Professional Development Registry the personnel are on in their career path. And we ask the provider to verify that with the yes or no button, and we direct them to remedy that if they think it's incorrect. And then we go to the self-report questions. And so this is an example of a screen couple in. where we ask the provider whether they're going on the family track, the center track, or the Head Start track. And although it's not actually required by QRIS, we do ask them about their enrollment. We did that because some of the administrative data wasn't as complete as it could be. So we actually asked the provider what ages they serve. You can see that the web system grays out the fields that don't apply, and they can tell us how many kids they have on subsidy, and at the various age ranges and the various kinds of subsidy, essentially because we had ready access to data about kids who were on CCDF, but not kids who were on, say, TANF or child welfare. So we simply asked about all of them, and we can validate the CCDF number easily enough, and then we can essentially, and then we can know how valid the other data are on the child welfare and the TANF side, which is partly for planning and partly for research purposes. And then we have questions like so you can see a header that shows the provider which of the 8 areas we're asking these questions about. And so these are questions that they have to say, yes to all these things to achieve the top step level. The web-based application, when the provider finishes, it gives automatic feedback to the applicant. So immediately the applicant finds out their score on each of the 8 levels and finds out their overall score. And in addition, we don't call it a quality improvement plan, but I think it's essentially the same information, where we show providers what they have to do in each of the 8 steps if they want to move up to the next level of quality in those areas. So the reports look kind of like this. There's 8 of these areas. So we have, for instance, on compliance history, we tell this provider current step is 1. Here's what you have to do to move up the step level to step 2 in compliance. Learning environment, this example provider is currently at 2. Here's what you have to do in order to move to step 3. And this bullet is actually one which would be calculated based on what's in the professional development registry rather than based on self-report. And this report goes on for each of the 8 areas. And sometimes they have one thing to do to move up, and sometimes they have a couple bullet points to move up. And this information is given to the provider, and it's also given to the resource and referral centers. Essentially, we use it for providing technical assistance to the providers. So in addition to giving individual level data on what providers have to do to move up, we also produce reports. So in aggregate, we give feedback to the R&R office on what the commonest barriers were for the various kinds of providers, the family, the Head Start, the center, the school age, what they have to, what the commonest issue is moving up to step 3, what the commonest issue is moving up to step 2, et cetera. What the issues were this year and what the same issues were last year for purposes of planning their technical assistance in aggregate. Now, it's the team at University of Southern Maine that does some tracking of the technical assistance. That's run by the collaborator Sonia Howard, who was on my second slide. But the Maine Roads to Quality, which is the name for the professional development registry at USM, they have a database that tracks technical assistance. They have a combination of structured and narrative data, and it could be a little bit more tightly integrated with QRS in the sense that individual personnel providing technical assistance can see the reports and they log the kind of technical assistance they give. They don't necessarily at this point actually check which step they're working on at the time, although it's something that we can certainly build into the system. So the way the system works is that a provider logs in, they answer all the questions, they see what their step is, and then after they see where they stand, then they can choose whether or not to press the submit button. And in fact, if they don't hit the submit button, we keep the record open for 60 days so they can come back and perhaps get some technical assistance and get the information they need to complete their application. and then they can come back and they can either choose to press submit or not press submit. If they do press submit, then it's still the state DHHS that actually issues the quality certificate. So they verify some of the information. And basically what they're verifying is the first area of compliance history and licensing status. Because the state still has some information of investigations that exist in pen and paper in some files. They might actually have to pull some paper to make sure that the self-report on status and the information we got from our data feed from the licensing database is accurate. And then they issue the certificate. And the certificates are good for 3 years. We share aggregate reports with stakeholders. So there's a couple, and we also automatically email providers in advance of the expiration of their quality certificates. And we also integrate with our parent child care search tool. So I have a couple of screenshots to show you. So the first is what the report looks like that we share with a fairly broad group of stakeholders. It's online. I mean, these are all public data. So this screenshot's a few days old, but the one that I pulled up my current browser shows that as of today, we've got enrolled in Maine's Quality for Me system. I see that we have 1,044 providers enrolled, and that represents 52% of the licensed providers in the state of Maine. We've been running this since 2008, and we've been at just over half for, I think, at least a year. The family, friends, and neighbors don't participate. This is in order to be eligible to participate in QRIS in Maine, you have to be licensed, and you have to have had a license for at least a year. And for many providers, participation is voluntary. The state has decided about a year or two after we opened up in 2008, the state decided that for those providers who accept CCDF subsidy, participation is mandatory, unless they get a waiver, which is pretty rare. And waivers might be granted for programs that have not technically had a license for a year because they've moved. And so we would the state typically lets them continue to get subsidy. And you can see we have data here on what levels of quality the providers are at. You can see some fairly dramatic results, such as 2/3 of our family child care practitioners are at the lowest of the 4 steps, versus just under half of the centers are at the lowest of the 4 steps. We're also integrated with the child care search page, which is a service that we provide to parents. So this was also developed at University of Maine. And it's a Google Apps application where there's a search page. You can put in your zip code or your address or your town and search for child care centers, and you get a little Google Maps up like this, and you can get driving directions. And if you click on the provider, you can find out some information about them, like what ages they serve. And you also find out what their QRS step is for those programs that participate in QRS. And you can also, when you filter on the search page, this is the results page. If you're in the search page and you filter by ages served or family versus center versus both, you can also filter based on QRS. I only want to see top quality programs. I want to see step 3 and 4 programs. I want to see step 1, 2, 3, 4 programs, or I'll take anybody even if they're not participating in QRS. So there's a couple ways that we ensure data quality. One is simply obviously by the self-report system. The web forms are pretty smart to gray out things that are impossible that couldn't possibly be right. On the professional development side, we show the provider the data that we're going to do our calculations based on, and they have a chance to verify it. And then on the self-report side, we do portfolio reviews where somebody from the state DHHS visits a random sample of providers he only, this is Chris Michaud who does this, he only visits those programs at step 2, step 3, or step 4, because step 1 is the lowest step if you're participating in QRIS. As of July, he had visited 100 providers, which is just under 10% of our enrollment. And among those 100 providers, 90 of them did not require any technical assistance to maintain their step, and the other 10 had some kind of documentation that they were missing, something requiring technical assistance. And so far, no one's dropped in step for failure to adhere to a technical assistance plan. So the portfolio review is basically to make sure that the provider has supplied the documentation that the QRIS application says they have to supply to back up their self-report. And of course, the other kind of validation that I mentioned is the validation study that Dr. Lottie runs, and that's basically environmental rating scales, where we have significant correlations with ERS based on STEP.
Well, it's time for questions, but I have one first, and then we'll have everyone else kind of collect their thoughts and think about questions they might have for you, Alan. Like, what are your lessons learned, or what would you have done differently, or what are your next steps? Tell us a little bit about those questions.
I think that the integration of the various databases is very useful where we have it. So the integration of QRS with our Child Care Choices search page is great, and that was easy for us to achieve because the Humane team developed both of those. The linkages with the Professional Development Registry, we have them, but I think if we had done development of the Professional Development Registry and the QRS database at the same time, we could have probably built in those crosstalks from the ground floor. Now we're at the position where we have lots of linkages, but we essentially build them after the fact. And it probably would have been a little bit cleaner to build them in right from the get-go. I guess being able to get as many offices in on the ground floor as soon as possible would be great, because we do also, link with child care subsidy, and when we try to link with things like TANF, they weren't bought in from the very beginning, and so they don't, their database is separate, and so that's essentially why we end up asking some self-report questions to providers, because even though both those functions are within DHHS, those connections weren't built in from the ground floor, and so they're not as reliable. And the same thing happens with connections with the State Department of Ed, where I think we're going to build those connections. So we're proposing to do more research on outcomes with child-level data that's predominantly in the State Department of Ed, but we essentially have to wait for those connections to be built, and which is happening, but it probably would have been more cost-effective to have them built into the system. You have to have them baked into the system from the very start.
States, other questions for Alan or reflections?
So this is Teresa Holly. So the structure of your system is that not everybody is going to get a visit to come and see whether your portfolio is right and valid and all that. You're basically picking a selection of people to go out and do that with, right?
That's correct.
Okay. And how has the validation study turned out? Is it showing that this method is lining up pretty well with what ERS scores and all that are?
Yeah. So the ERS scores for step 1 on the average ERS scores go up as the step goes up, and there's some interesting. You saw from one of the aggregate reports that there were a disproportionately large number of family child cares at step 1, and a disproportionately large share of the centers at the higher steps. And that's actually exaggerated for the Head Starts. Almost all of our Head Starts are essentially at step 3 and 4. When we do the validation study, that pattern is even more dramatic, where what we have is a random sample of family centers and Head Starts at each of the 4 levels. And what we find is that even when you essentially partial out the effective step, the ERS scores for families, child cares are lower than they are for centers or Head Starts, even if you compare step 1s to step 1s, step 2s to step 2s, 3s to 3s, 4s to 4s. So that's but in spite of that, we still have 1s less than 2s, less than 3s, less than 4s. I will tell you that there is still a lot of variability. Most of the variance in the ERS scores is not accounted for by step.
Mm-hmm. But the other thing I think you're asking too, Teresa, is with this methodology of random samples to verify the portfolio and the self-report, because I've heard Michael speak about this a couple of times, I think that all programs know they could be verified, that their portfolio could be verified. And you guys are peeling, what, like 10% to verify?
Yeah, I think that the initial plan was for DHHS to do to visit 25% of the programs each year, but funding got very tight fairly recently, and so that's, I think, the reason that only 10% have been visited so far.
But I think Michael is finding, and if you could confirm this, that self-report in those circumstances was fairly good when validated, right? Like when you went out and looked at the portfolio, you were finding good alignment between what they reported and what you could find on site.
Yeah, not 90% of the portfolio reviews were validating the step that was assigned. Okay. And the remaining 10% were issues that were resolved with technical assistance. So no one's of the 100 portfolio reviews that have been done so far, none of them has resulted in a change of step. There were a small number of
states are very interested in that data. Are there other? Yeah. Well, I didn't want to cut you off, but are there other questions about that? All right.
Oh, and you asked about cost too, right?
Mm-hmm.
So, this has been an ongoing collaboration since we went live in 2008, which is when I joined the project, and the collaboration, at least with the University of Maine part, has been going on since 2007, when we set about building the online application. And pieces have been added along the way, like the child care search page just went live a few months ago. And we also provide support to the research team at USM for doing their environmental rating system administrations and supporting some of the research questions. So it's hard to pull out ongoing costs versus cost to build because it's been built over time. But ballpark has been about $200K a year. And since, like I said, since 2008. And that's counting the work done by USM and UMaine. That does not count the professional development development registry part. That counts just QRIS and the on-site. It counts QRS and I guess doesn't quite count the on-site. It includes the support of the on-site validation. The actual performing the ERSs was a separate funding stream that's not included in that $200K.
Can you go back to the CQI plan? I remember seeing that based on what they enter in their data, it gives advice about what they would need to do to get to the next level.
Yeah.
But the CQI plan, does it have a interface where the center might add in other sources of evidence or other ideas about what their CQI plan with benchmarkable features or and assignment features, or is it pretty much just like the standards and here's what's next in the standards?
It's the standards and what's next in the standards.
Okay.
So any other information, now the technical assistance is tracked with that combination of structured and narrative data. And so the database that actually tracks the technical assistance might have more information. But in terms of what QRIS provides, it's just the standards and what your next standard is to move up.
Okay, great. Other questions from states for Alan? We have 4 minutes, right? Any questions for any of our states or any of the information that you've heard today? Well, then I'd like to thank the states that participated in the webinar and especially our presenters. The webinar will be posted on the QRIS National Learning Network. On the left-hand side of the menu, you'll see a section that's called Webinars, and if you click on that, you can access any of the webinars that we've delivered, and this one will be posted up there. You have the contact information for our presenters today. If you would like to follow up, I'm sure they'll entertain a question or two. And again, we'd like to thank the Early Learning Challenge Collaborative and everyone that's been part of this today. And give Jerry and myself a day or two to post the webinar up. But I'd like to thank everyone again.
Thank you. Thank you.
Thank you. It was just fantastic.
Really helpful.
Great.
Thank you.
All
Thanks,
right.
everybody.
Thanks.
Bye.
Thank you. Please stand by.